Good morning. My name is Brenda Langford. I'm the president of the NNOC Region 13 of the Nurses Union that represents the nurses of the Cook County Bureau of Health System. I am a registered nurse at Oak Forest Hospital, where I've been for the past 10 years. I'd like to welcome everyone for coming out to our vigil this morning. I want to take this time now to thank Commissioner Sufferton for his support and for protecting the patients and the caregivers of Cook County for those who would dismantle our healthcare system. I also want to thank the other commissioners who are supporting the patient's budget, Commissioner Claypool, Commissioner Quigley, Commissioner Maldonado, and Commissioner Paraica.
Yes.
We are here today in hopes that our messages will be heard and our prayers will be answered. Our patient's budget gives the commissioners the opportunity to begin restoring patient care services and to do so in a financially responsible manner. Over the past 5 years, the Bureau-wide nursing staffing has been cut by 266 positions. That's 15%. The clinics have lost over 30% of their nursing positions. Our patient's budget begins the process of rebuilding the Bureau's mission by restoring 109 positions which were requested by our medical department but eliminated in the President's proposed budget. Our patient's budget begins the process of rebuilding our primary care clinic network system by reversing the President's nurses cuts and restoring 13 nurse practitioners requested by the clinics but rejected by the President. Our patient's budget actually generates revenues. Nurse practitioners can bill for the care that they provide and restore them to the clinics could generate, we estimate, almost $19 million for the Bureau, which is 2.5 times the cost of our entire budget amendment. Our patient's budget saves the county money in other ways also. By rebuilding our clinics, we can treat our patients in a primary care setting. This reduces the expensive and dangerous diversion to the county's overcrowded emergency room services. Our patient budget saves lives and it saves dollars. We ask that 4 more commissioners join us and do what is right for the patients and what is right for the taxpayers and vote to support the patient's budget.
All right.
Good morning. My name is David Goldberg. I'm a physician in the Division of General Medicine and the Vice President of the Executive Medical Staff. The doctors fully realize that medical care is teamwork and that at the heart of the teamwork is the work between doctors and nurses. So on behalf of the medical staff, I want the nurses to know that we fully support your efforts to restore the nursing positions and look forward to a rejuvenated health system in which the doctors and nurses are able to serve more patients and do so in a way that's done with dignity and the kindness that you always deliver. Thanks so much.
I'm very, very concerned about the healthcare crisis in Cook County. I serve in Rogers Park in the 13th district, and unfortunately, our folks have to travel all the way to Cook County Hospital to get services. And while Cook County Hospital is a wonderful hospital, it's just so far for us to have to travel. And if the cuts continue, then what's going to happen? How are the people who are already underserved, identified by the federal government as an underserved, medically underserved community, how is that community that's already underserved going to be served by a hospital that continues to be cut in services? I'm here to stand in support of the nurses here today. I'm here to say that we need to not have a budget that is always carried on the backs of the poor, but that we need to have a budget that looks out for our patients, looks out for our community, and looks out for the people who need it the most.
Now we're going to ask all of our participants here to place their candles in the ground in front of the speakers here. And these candles are a symbol of the lives that will be lost unless we have a patient budget approved.